mention on the seating over there, we have our Sue Budden, Director of Corporate Services, Lee Drawbridge, Deputy Assistant Commissioner for Fire Safety, and Tim Powell, Assistant Director for People Services. So should you need any extra assistance, I very much doubt that you will, but should you, our experts are sitting there. Okay, so I'm going to start with the questions as is normal. Can you provide an update on fire fatalities in London? I don't mind which one of you first.
Absolutely, yes. So obviously it quite often comes to light over this period that we seem to have a trend of more fire fatalities in the winter months. We've had 7 fatal fires between the 1st of December and now, 3 in December and 4 in January. They're not higher than normal, and actually there's no specific trends with any of those. So if we look back to the rolling 12 months of quarter 3, there have been 45 fire deaths during that time. What we find is more useful now is to break them down and have a look at them by cause, and specifically whether or not they're deliberate and accidental. Obviously, it's quite difficult for us to have an impact on the deliberate ones, and there were 11 deliberate ones during that period, being suicide, homicide and combustible materials deliberately ignited. But the accidental one of the things that we are finding there is a trend is a lot of human cause, specifically in relation to unsafe practices. So, for instance, people sitting too close to fires, people using inappropriate means of heating. So in relation to those, there's a large number of those. So what we did over the last couple of weeks is we've actually run a safer heating campaign, specifically targeting some of our boroughs where we know there are people who are more vulnerable and at risk. And during that period, we saw over 400 people in 7 boroughs and were able to provide them with specific information around issues to do with safer heating. Last year, we had 6 fires every week in London involving electric heaters, candles and open fires, many of which we think could have been preventable. So we think by specifically targeting those people who are at risk and providing them with information, especially in relation to things like carbon monoxide poisoning as well, where we've got people using unsuitable items and not having carbon monoxide alarms. So all those factors together, those people we've been targeting, we hope to see, directly safer interventions made for those people. And we've also been referring people where we've discovered people in fuel poverty, because obviously they're specifically at risk, and today is a classic example of the weather where we're going to see a highlight of people trying to keep warm in difficult circumstances.
Is there a specific age profile?
It tends to be older people, but it is just about money and lack of it, and people just trying to keep themselves warm on cheap means. We found an elderly couple whose boiler had been broken for some time, didn't have the money to repair it, so they were relying on a sort of heater fan mechanism in their living room area, which shouldn't be run for extended long periods and left unsupervised, but that was the only heating they had. So it's actually identifying those types of people who are very specifically at risk, and that one-to-one intervention stage of them being able to come along to our fire stations and have the conversation. It also enabled us to then, make safe and well visits to them and referrals for them to make sure that, a number of other factors like whether they've got fire alarm, smoke alarms in their house and that sort of thing, and providing them with the ability to get carbon monoxide alarms.
Yes, that's sad, isn't it?
Yes. Can I add to this? I think I mentioned at the last meeting we had that I had a couple of in-depth briefings on fire deaths at 2 of the meetings I had with senior staff in the autumn. And one of the things that we were able to drill down, and I think it sort of perhaps surprised quite a few people in the room, as well as that age profile, sort of the typical person who might die in a fire is actually a white man aged over 60, living alone, potentially with issues with alcohol. That doesn't mean other people aren't at risk, but actually the statistics were substantially higher for that demographic than any other group.
Okay, that's very sad. And we're thinking this is turning into an upward trend?
We hope not. I think it is just, specifically there seems to have been a lot in a very shorter period of time. But we conduct a review after every fatal fire to ensure whether or not there was an intervention that could be made by anybody at any point, whether it's ourselves or any other public sector organisation. One of the things we have done, the evaluation of the effectiveness of our home fire safety visit, and it shows with vulnerable people that are 18 times less likely to have a fire if they've received a home fire safety visit, which sort of emphasises the importance of us targeting the right vulnerable people for our home fire safety visits.
So during those safety visits, I know what you used to do, but do you actually now put that into it as a part of it? Don't sit too near.
Absolutely. Not only are we looking at the classic risks of things like smoking and, you know, careless disposal and people being bedbound, but actually speaking to them about the issues around, you know, not drying their clothes next to the fire, not sitting next to the fire, not leaving fan heaters and things on overnight if they're unprotected. So actually identifying, because, you know, you can pretty much tell when you're going to some, especially some older people, their houses are freezing and you're going to just one room that will be kept warm. And we found someone who had their oven switched on and was trying to use that as a means of heating their house because it was the only access to warmth they had. So it's a, you know, it's a really tragic story, but the fact that we can make those interventions and try and make those people safer, it's really important.
Yeah, okay. And they would all fall into that category that I've forgotten the number. Is it a C1 or
P1 people?
P1.
So, and some of them aren't P1 people, so which is why when we've looked at how we target our home fire safety visits, that we are not just looking at P1 people necessarily, because, you know, some of these people you wouldn't necessarily recognise as being P1 people. It may just be that they might have lost their job recently and then they haven't got money and access to be able to pay their heating bills and pay their electricity.
It's getting access to those people and the knowledge is so difficult. Yeah. Thank you. What steps is the brigade taking to reduce the rate of primary fires in those London boroughs with the higher than the national average?
Yeah, so currently at the moment, 24 of our boroughs are below the national average, so obviously we will continue to target the boroughs that are higher. And what we are doing is the focus targeting on the vulnerable people in those boroughs and the work we're doing about fires involving vulnerable residents. One of our focuses specifically at the moment has been on care homes and the work we're doing to try and ensure, because, you know, quite rightly, if you have a family member or a friend in a care home, you'd expect them to be receiving a really good form of care because they're in there and they should be safe in there. So we've been doing a lot of work at the moment, and we're working not only with, you know, providers but with the Care Quality Commission to ensure that the right measures are being taken, the right people are trained and in place to respond if there is a fire event, because obviously those people are vulnerable and quite often unable to leave without assistance and things. So we are making sure that not only we're targeting the boroughs that are over the trend, but actually the people in the boroughs who need our help the most.
Okay, we mentioned home fire safety visits just previously, and yet the visits decreased in the year to the end of September. Is there any reason for the decrease in visits?
It all actually feeds into the same story. So it is, although we are over our actual target for it, the physical numbers have decreased, but the reason for that is because we are trying to use a more intelligent and focused approach to those home fire safety visits, and part of that is about spending longer with individual people. So rather than just going in there and targeting, putting a smoke alarm up, we are then having the whole conversation about the safe and well. So looking for things like, you know, worn rugs that people might trip on, cables running underneath rugs that are getting inappropriately worn, looking for signs that, you know, whether or not there are any safeguarding issues. So that is about more time on visits. The other problem is that obviously, quite understandably, following the fire at Grenfell, lots of people are asking for visits who don't necessarily fall within our targeted area, but quite understandably and quite rightly would like a visit in a high rise. Yeah. So they are, you know, into the numbers, but they don't count as our sort of targeted numbers. So, you know, we are being more specific about who we're targeting, making sure the most vulnerable people get our assistance first.
Some boroughs have always been much better at doing the home fire safety visits than others. What are you putting in place to try and make sure that there are levels for all the boroughs are up?
So our borough commanders are measured on their home fire safety visit achievements in their boroughs. So each of the area DACs will have one-to-one meeting with the borough commanders to ensure that they are meeting their targets. And if they're not meeting them, or if they're not specifically targeting the vulnerable people in their areas, then that is a conversation that takes place. And obviously overall seen by Andy Rowe, AC of Fire Stations, who monitors across the piece. So it is about the individual borough commanders. But I've also tasked all of our borough commanders specifically with recognising the individual risk in their borough, because as we all know, the risks in, you know, the borough of Sutton are very different to the borough of Tower Hamlets. And the borough commanders, station managers and the fire station members of staff themselves are the best known people to be able to identify who is at most at risk and know where they are. So it may well be that, you know, that what the work we're doing in Sutton will be very different to Tower Hamlets, and it's ensuring that it is matching the risk in the borough.
Okay. Do you want to say anything, Fiona?
No, I think I'd sort of echo what Dany says. I think we do know that home fire safety visits make a positive numbers, and therefore they make a positive difference, so numbers do matter. But I think it's that quality intervention that actually will make the most difference. And I think we will continue to monitor the numbers and make sure they are happening. I know the Commissioner's committed to that, but it is something that I also receive regular updates on as well.
Are we revisiting, because I mean I've been involved with through LVIPA for many, many years now. And the batteries have only got a 10-year life. So are we going back to the ones that we put in? Because some of them can't be replaced, can they? You have to replace.
Some of them are specifically time-lifed. I don't know if we've done a specific programme at the moment of revisiting. And equally, it may well be, you know, people move on, so vulnerable people change. So it is about ensuring we try and keep up to date. And one of the things I meant to say is we've been really pleased recently about the amount of success we've had in doing data sharing with local authority, about them being able to provide us the information about where vulnerable people are, enable us to do it in a more sophisticated way, actually using local authority data as well, because they hold obviously the data for where their residents live and if they're identified as being vulnerable people. But I will check back on the follow-up visits.
It does occur to me because it's that sort of period of time has lapsed now. So, okay, thank you.
Well, it's around the advice that they're given. So we will make sure we're focusing on the people that need it and targeting those most at risk of why, as the Commissioner says, we find lots of turnover in residents. So those people may have moved on. The real impact is not just around the smoke alarm; it's the quality of advice that our firefighters are giving those vulnerable people.
Okay, it might be something to look at. Thank you. Andrew.
Just a quick one, Dany. We're still below establishment, I assume. And the idea is to get up by June.
Better. No, we're very nearly there. By June 19, we will be at establishment.
Okay. How far? What's our? How many have we got now? And what is the establishment number?
I haven't got the exact numbers of where we are now, but I do know that by June 19. But Tim might have it off the top of his head.
Operational frontline vacancies at the moment stand at 150, so we're on track to get that done by June 2019, as we've said previously. And then beyond that, we know that next year, to maintain establishment, we will need to recruit 230 operational firefighters to keep pace with anticipated turnover and so forth.
I mean, obviously that impacts on how many of these visits you can do. And while I'm on there, just another question. FRUs, will you be recruiting FRUs at 5 rather than 4 when you get to full establishment?
That is always our aim, to crew at 5 where we absolutely can. And so once we've gone to establishment, you know, that we won't guarantee we'll do it on absolutely every occasion, because circumstances, you know, if you had a high spike in sickness or something, our aim is to recruit them at 5 because obviously it's a better working number.
Okay, Andrew, your next questions.
Not David's next, I think.
No, you were doing. You swapped it.
Dany.
Oh, right. I'm sorry. I thought you were still doing that one. No. The outreach work with young people, you've got a target to reach 100,000. How are you getting on with that?
So actually we're doing very well with that, but in terms of the numbers we record, because previously we recorded numbers only for specific activities, we have to look at the actual groups that we record as numbers. But we routinely engage with in excess of 200,000 young people annually, and there's such a wide range now of our young people in hard-to-reach groups that we're doing through various different methods. So not only obviously through our very successful cadet programme and life programme, but Crossfire, which is a long-standing activity we do with schools, with a youth multi-agency project that actually in specific boroughs target specific need. We also work with a charity called Fearless. We've started delivering a new workshop around criminal exploitation of children selling drugs to try and prevent them getting into gang culture and drug culture, which has been very successful. So, you know, we also do the Prison Me No Way, Safe Drive Stay Alive, and all those are very much targeted at young people, trying to get that intervention into them before they become victims. Junior Fire Set is another one where we obviously respond to specific needs where people have identified that young people might be in the habit of, you know, arson and fire setting.
How do you measure the impact of the work?
So we have seen a reduction in hoax calls made by young people, which we think is a direct result of a lot of the interventions we make. We have found very much that, you know, things like life courses and cadet courses, not only do impact on the young people who attend with us, but the behaviour they then exhibit when they're back in their peer group. So, for instance, you know, we've had people who've told us that they have attended either through life or cadets, have gone back out with a gang of friends, either school friends or otherwise. One of them has then suggested doing something, either something like setting fire to rubbish or making a hoax 999 call, and they've turned round and actually persuaded them not to because they see London Fire Brigade very much as a supportive ally to them, and therefore they discourage the behaviour in their friends. So the knock-on is not only directly about the young people we have direct contact with, but the message that spreads amongst their peer group.
Okay, and the fire cadets you mentioned, we're not in every borough. How likely is it we can spread it to all the boroughs in the forthcoming year?
I am very hopeful we are making steady progress. So we currently are in the process of opening up another 5 boroughs. So we've got the 13 we've got going at the moment, the specialist units where we have the marine and the junior units. We're also opening another 2 specialist units, one in Croydon for special educational needs children and another junior unit in Bromley. We're also opening Barking and Dagenham, Kensington, Chelsea, Lambeth, Newham and Waltham Forest. So we're making very steady progress, but any help that anyone can give us to support us opening more cadets units will be very gratefully received.
And have you looked at charitable foundations to try and help them with it? I noticed I was doing a Jack Petchey Speak Out session in Barnet last week, and I saw that the Jack Petchey Foundation, for example, supports Army cadets and police cadets. Have we approached them, for example?
I don't know if specifically we approached Jack Petchey, I will find out, but I do know that the team who look after that look to any funding source we can secure. And it is, for children who are potentially on the cusp of getting involved in gangs or getting, influenced by other children. So it's a really good age for us to be able to make that intervention. And we're really pleased now that we've addressed that previous gap in our provision and are able to provide that targeted address for the younger people. I think that, it's too early for us to say how successful they've been. We would always say that any intervention we can make with young people is going to be a success because we know the stories where we've turned people's lives around completely. That life courses are not cheap to run, so it is something about ensuring we have ongoing funding for those. But, looking at all of the situations of crime around London, especially the awful rise in things like knife crime and young people being involved in all those crimes, I think where we can assist supporting the Met Police in any encouragement and development of young people, it's vitally important for us to do so.
Yeah, of course. I mean, how would you measure the impact and outcomes of what they do? And also, can you tell us how many you've reached with these courses so far?
So the impact and outcome, sometimes it's not tangible. Local areas, very clearly. So when we started off the life courses, they were started off in Shadwell as a direct result of attacks on firefighters. So we specifically targeted that area. And to begin with, I think a lot of people, looked at us with some scepticism to say that you're being attacked by these young people. Now you're inviting them into the fire station. Have you sort of got a few marbles loose? But the answer is that we found out by reaching out and making the direct connection, and lots of these people, they hadn't got any kind of steer in their life. They hadn't got someone who they felt they could turn.
Firefighters, they notice the difference in the relationship they have with the community and young people. That's great. I'll ask you about alleged fire risks now, because when they're reported, you're supposed to respond within 3 hours. But the figures I have is that the percentage of responses within 3 hours have gone down from 94.2% to 90.5% over the last year. Can you comment on that and say what you are going to do to try and increase the rate at which you respond within 3 hours?
Yeah, absolutely. I'm pleased that they still remain above 90%, which is our target. Obviously, it's very important. Some of the issues we've had have been around an increase, understandably, since Grenfell Tower, of people phoning up to report things that aren't actually alleged fire risks when we investigate them, but they are generally concerned people, which you can understand reporting things. So what we make sure we do on every occasion is obviously we distribute the ones that can be dealt with to the local fire stations, who will make that attendance and make the intervention. And quite often it's something as simple as, pointing out to somebody they've left a fire door locked, closed and things. Quite often not intentionally done, just something that's been... And sometimes people don't feel comfortable to raise that, if they went into something like home base or something, so they ask us to come and do it. Some of them are more complicated and require our specialist fire safety teams to go out and actually have an intervention with the people on scene and to explain where the deficiencies are, and if necessary set them an action plan of what they need to do. So we will continue to make sure we prioritise those that are a concerning risk, especially if they can concern a life risk or a sleeping risk. Those are the ones that will be our first priority. So for instance, where we have people reported in sleeping unsuitable accommodation, maybe above a restaurant or something with no means of escape, those we have to prioritise those quite understandably, and we then will continue to respond to the other ones that are, although they are lower levels, they are genuine concerns from people, and we would never discourage people to stop raising those.
Well, what's happened to the absolute number of those alleged fire risk reports over the last few years? Have they gone up or down or stayed the same?
They've definitely gone up recently, which is not a surprising trend. And I think the more that people are aware that they can raise those risks with us, the more they will do it. And in some ways, that's not a bad thing, where people are, I would rather somebody had raised a concern and that we'd been able to come along and make potentially a low-level intervention that had then prevented something becoming more serious later, or if, heaven forbid, a fire occurred, something tragic happening. So, you know, we welcome people doing that. It is just explaining to people what is a priority risk for us to attend, you know, and what can be dealt with in sort of normal office hours.
Great, thank you. And I'll move on to something else now.
Can I just intervene for 2 seconds? Whenever I've been to youth programmes, they've been pretty diverse, which is fantastic, and it reflects the communities in London. Are you targeting those that have done well on the various courses to see if they can pursue a firefighting career?
Yes, in fact, I've specifically tasked him with conducting a piece of work to ensure that we don't lose, especially the cadets. You've seen recently, our cadet programmes are just fantastic, and the diversity on those groups is absolutely amazing. So, and what we don't want to do is lose them between the period in which they finish cadets and then are eligible to join to apply as firefighters. So we're working on how we can bridge that gap. A lot of it is about encouraging them to come back as adult instructors and continue to support them. But it is part of the ongoing work that Tim is doing in relation to outreach and recruitment. And it is specifically about, and also about looking, bear in mind those young people have committed all their time and actually shown dedication and commitment to the London Fire Brigade, about how we can ensure that feeds through into their application to make sure that they're in a place that's ready to come through and join us as firefighters.
Good. And one last quick thing, as you know, I've always been a massive supporter of the LIFE scheme. Are we looking to put on more where, excuse me, we've got real issues with youth violence in London? Are we looking to put on more in those areas?
We'll absolutely look to put more. It is just sometimes a case of they are very expensive, as you're aware, and making sure that we have the funding to do that. But it is about making sure we target the right areas for them, because you say there are areas where we can definitely make a more significant change for young people.
Okay, thank you. David.
Thank you. Yeah, I'll carry on. The next section I was going to ask about is your response and resilience times and statistics and things. And so I understand that when there's a 999 call, your aim is to answer that call within 7 seconds. So can you tell us how that's going in terms of answering 999 calls effectively? How much, how well do you do that, and has the rate at which you do that increased or over the last few years?
Yes, I'm very pleased to say that with the reintroduction of the automatic call distribution system in control as part of the technology we have there, it's having a very positive impact on our call answering. So in the 3 months prior to the introduction of it, we saw an average call pickup time of 4.6 seconds. In the 3 months post the introduction of it, the average call pickup time was 2.3 seconds. So obviously a 50% improvement, which is really remarkable. In December last year, our call pickup time was recorded as 0 seconds, so that all 999 calls received an answer from the LFB immediately after being connected, which is obviously, you know, ideal and where we want it to be. And based on that data, if the performance continues in the same manner, 999 calls answered within 7 seconds indicator will be back on target very soon. So I'm really pleased with that.
Thank you very much. There's one more question I'd like to ask you, which is about your aim to get first pump to a fire and second pump to a fire within a certain time. You see the target for the first pump arriving is 6 minutes, and the target for the second appliance is 8 minutes. And I understand that your response times have gone down, which is very good. But I'm looking through the specific response times for boroughs, and there's one borough that stands out as having a much higher response time than others, which is Hillingdon. So for Hillingdon, you have the first pump 6 minutes 13 seconds, and the second pump in 8 minutes. It's the only one which is the only borough which has got a response time over 6 minutes and 8 minutes for the first and second pumps. Can you say a little bit why Hillingdon has such a long response time, and what you are going to do in the future to address that?
Yeah, so obviously part of the issue with Hillingdon is its size of the borough itself and the location of the fire station. And I think that, you know, we have to recognise that sometimes our fire stations aren't always placed in the best ideal position, but obviously the cost of redeveloping and rebuilding a fire station is phenomenal. What we have done is made sure we've worked specifically with the local crews to ensure that our turnout times on the fire station themselves, so that the moment the bells go down effectively and our crews are actually leaving the fire station doors, is as swiftly as possible. Because obviously, you know, our mantra every second counts, and we want to make sure our crews are turning out in a timely fashion. We also know that the system we have now in control that allocates the nearest fire appliance, regardless of whether it appears to be on that fire station's ground, they will pick the geographically nearest one, and that has helped us within making sure that the call times are maintained where they are. There's, you know, not many fundamental changes we can make in Hillingdon Borough because of the size and the location of the fire station, but we will continue to work with local crews to make sure that they are doing their very best to meet their attendance times. And sometimes it does, you know, depend if they are obviously out on another call somewhere and we get a neighbouring station come in, but you know, we constantly monitor all of our attendance times. We're very pleased with our attendance record and our clients is arriving. And it is also about making sure that all the work that is valuable work that's done in our control room about the call handling and the call challenge is done as well, to make sure that we are attending the calls we should be attending, and we can filter out the ones that, you know, obviously are not 999 calls. And as you know, we all receive, all 999 call handlers receive a number of those that are not appropriate calls.
Okay, thank you.
Okay, thank you. Before I bring in Assembly Member Eshalomi, can I welcome to the Chamber members of the London Explorers Club? You're very welcome. Right, okay. Sorry.
I'll just say one thing. Three of us managed to go and visit the Vision Centre just before Christmas, and I think we'd all agree that it was a really fantastic visit. And the automated call distribution, we actually watched it up and running, incredibly effective. Yeah. It was a really great visit, and it's a really good piece of kit, and I can see why the figures are really improving. You must be very pleased.
And thank you very much for taking the time out. I know from the feedback I had from the staff, they really appreciated the visit. I know sometimes because they are kind of...
well, that's good, because you're sometimes slightly concerned as an Assembly member because you're turning up and interrupting someone's work.
No, absolutely not. They genuinely welcome it. They welcome the fact that people are interested and want to support them. And because they are a kind of unique, dedicated group of staff who are locked into their workplace because of the work they do, then they really do welcome people coming in. And as much as anything, so that, you know, people genuinely understand the work they do and can see what a committed, dedicated, passionate group of people they are. And, you know, very professional in the work they do. So thank you for taking the time to do that.
Yeah, it doesn't matter how good the kit is if you haven't got good staff.
Yeah,
and you've got exceptional staff, and we enjoyed ourselves, so thank you. Flo.
Thank you. I just wanted to focus on people and resources now. So looking at the figures, unfortunately the number of days lost to sickness across the organisation continues to rise across all staff groups. So that's in operational staff, fire and rescue and control. And one of the key reasons for sickness is we have reported stress, anxiety and depression across all three groups. The health and well-being of your staff is obviously quite crucial and important. And just going back to that visit, one of the staff members that I sat in on the call with, she'd unfortunately handled a call where the person did die because they didn't get to them on time. So it was a case of hoarding, and, you know, she explained to me that, you know, how tragic and difficult it was listening to effectively the call on the other line, dying because, you know, from fire. And she did outline the support that she got from her line manager and said it was really good. But effectively, how are staff and all your officers aware of that additional support that's available to them?
So, and I know many people be aware because it is a topic that is very dear to my heart and something that I have been promoting hugely, especially since Grenfell, but not only in relation to that, because I think that was the one event that enabled me to highlight the importance of mental health and well-being of people who respond to those types of incidents, and very much that it's not just about the frontline firefighters, it's about our control staff taking those calls, it's about the officers, and it's about other people who deal with it. So we've put together a really good package in my mind of things we can do to help support our staff, because what I have learnt over the last couple of years is that one size doesn't fit all. Yeah. So it needs to be what suits the individual and what they respond best to. So some of our staff, it's definitely our fantastic counselling team, our in-house one. I mean, they do absolutely sterling work. You know, luckily we've been able to double the size since Grenfell because of the increased workload, and they continue day in, day out. So following any traumatic incident, a contact is made from the on-duty counsellor to the watch or the team involved. So we make that initial contact to say, you know, to the teams, do you need any additional support now? Is there anything we do to help you? And then we follow up on those calls. And we have triggers for certain events that we deem to be traumatic, but we can also then be individually contacted by people, or if the watch manager or whoever's in charge feels that there's somebody that needs direct contact, then they can phone in. So there's an on-duty counsellor 24/7. We've also been doing a lot of work with Mind Blue Light Champions and encouraging lots of people within London Fire Brigade to become Blue Light Champions. I'm one myself. To date, we have 140 Blue Light Champions across the organisation, and we're aiming to get that up to 250, which gives people a different set of people to have access to, and that's about the general day-to-day. That isn't just about, obviously, responding to operational incidents. That's, you know, each and every one of us face challenges in our life, whether it's at home or at work, and it's about being able to identify when people don't seem right and give them a platform and someone to talk to where they feel they can be safe and just express that they're not feeling great and have a chat with somebody. We've also recently established, I'm very pleased to say, a staff mental health support group called United Minds, and it's part of our wider equality support group network, and it's to align all of our mental health wellbeing initiatives, and you know, that's a really good, and that's been something that's been developed by staff for staff, so that makes it that much more powerful for people. We've also made sure that we give all of our new trainee firefighters an input on our counselling and wellbeing as soon as they join us, so they're aware of the facilities there. And we're looking at the feasibility of introducing a peer support team, so peer trauma support on watches themselves, so that people can be trained individually on watches. Some people, as we know, firefighters like to just keep things amongst themselves, talk to each other, and then sometimes they feel they talk to people who understand because they were there. So having people on the watch who've got that additional level of training and support. Because quite often I think what happens is people will turn to the person in charge of the watch, and just because they're the watch manager doesn't necessarily mean they're the best person to be able to deal with that, or they feel equipped within themselves, or it may well be themselves that needs the help. So it's about having somebody, and absolutely want people starting from on the floor level, so people in teams and firefighters taking that role. And in line with that, we want to look at the whole of the wellbeing package because, it is about mind, body and soul and everything together. So I think a number of you are aware we've started another new initiative which has once again grown from the shop floor, which I'm delighted about. So not only have we had the initiative of the Green Champion, and we've had the initiative of the mental health and wellbeing for one of our firefighters who's going around individually talking to watches about his own mental health experience. And he came to us and spoke to us about that, and we've got him that. We've now got another chap who is very keen on issues around healthy eating and well-being, and I think you met with him as well, didn't you? And Susan did, to talk to him, and we've detached him in to go around talking to watches about things like portion control, which firefighters aren't always the best at, and he does a whole very good piece about what you should eat and when you should eat it and how much of it you should eat, rather than just getting as much of it on a plate and yaffling it down as quickly as possible.
Pasta.
No, I've got a confession. I shouldn't say this, but visiting the fire stations, you've definitely got a better selection of biscuits than your Met colleagues.
We're trying to encourage them to think about fruit as well as an option and various other things, but I think you did have the opportunity to meet him, didn't you?
Biscuits not part of your 5 a day?
They've got currants in them or fruit.
But portion control didn't please Fiona and I a great deal.
Well, I'm not that great at it myself, but I think the point of the presentation that the chair and I were fortunate enough to see at Dagenham was around the fact that actually, contrary to what the public perception might be about sort of firefighters being physically fit, that actually there are higher levels of heart disease among firefighters and among the general population. So it is something that is actually there's a business case for making sure that there is that focus on it, and I think that we could replicate the presentation here if people are interested in seeing it. It was a really interesting session.
No, that's quite good. Yeah. Just following on from that, so again, I touched on the sickness level. So there was a managing attendance policy that was issued in August 2018. Mm-hmm. Could you provide, it may be too early, but could you provide any updates on that in terms of how you're addressing attendance across the brigade?
Yeah, so in August last year we undertook a sort of small, quick and dirty review of the attendance policy. We know there are some fundamental problems. We made some minor changes to begin with, but Tim is undergoing a more comprehensive review of the policy as we speak, which we are hoping is going to report back for consultation in March, I believe, is the anticipated thing, to come back with that. So, you know, we are aware that sickness is still over target. We are... you know, I'm pleased to say that certain staff groups are showing a slight reduction in levels of sickness, but there are obviously areas of concern still. And the fact, you know, as you quite rightly identified, I'm concerned by the fact that the highest level for the second time is around stress, anxiety and depression. I'm not surprised, but I'm concerned, and that's why we're doing so much specific targeted work for that. But we do still know that understandably, some of those are still a direct impact and a result of the Grenfell Tower fire, and also of appearing at the public inquiry, because a number of my staff found it incredibly traumatic and difficult to face the prospect of giving evidence at the inquiry, and a number of those did report sick as a result of that. So we've done a lot of work with them to encourage them to come back to work and make sure they've got the right levels of support. But we will undergo a more fundamental review because I think there is still work to be done. We've been working very closely with the trade unions as well, because they're also keen for us to be able to address the issue and how we can work together to support people to come back to work. Because we know the longer people are off, and especially people on long-term sick, it becomes increasingly difficult for people to return to the workplace, whatever the cause of that sickness was. So it's about being able to put steps in place, and also being able to put steps in place so we can look at things like where people are off long-term sick with a medical condition that prevents them being an operational firefighter, whether they can be at work undertaking another role, you know, doing some valuable work, whether that's around, you know, looking at data to do with high-rise or various other aspects where they physically can't do the operational role, but they can be involved in other activity and be at work and be engaged and not be sitting at home feeling miserable.
No, and that's good. And I think to both of you, so on the back of that, one of the things that we've heard is that, that you know, the levels of understaffing has led to some of that long-term sickness where people are feeling that, you know, they're understaffed, so they're having to take sick leave. And this is then contributing to that. In a case, how are you working with the trade unions and staff to address this?
Yep. So obviously the big thing for me is getting establishment back up and having the right members of staff at the right workplaces so that people aren't put under that additional pressure. And as I said, Tim and I reported, very pleased to say that will be in June this year for the operational workforce. We've actually put on an additional number of firefighter trainee courses, some of which we're running in conjunction with the Fire Service College. And I was very pleased to meet up with a course of our trainees down there last week and have a good chat with them, and they're one of a number of courses we're running to ensure that we've got the right levels of staff. But the work we're doing with the trade union is about how we can work together about promoting the message about sickness absence and actually communicating with staff about the benefits of returning to work and not spending long time off. Because I think it does become a decreasing circle for some people if you're off for a long period of time, and you then can actually end up with depression, and then when you go back to the doctor doesn't feel in a fit state to provide you to be able to come back to work. And so providing that level of support and the early interventions, and also especially supporting the work of the Firefighters Charity to ensure that where we have got firefighters, both with physical and mental sort of injury, that we can support them going to the Firefighters Charity to speed up their rehabilitation and give that additional level of support.
Okay, then that's good. One of the things I've asked you both before is around that key target that both of you are committed to in terms of increasing diversity across all areas and across the brigade. And I know that you've developed the new talent management framework. Could you just briefly outline to us what that involves and any key timescales for delivery on that?
So the talent management framework is starting to be in place now, and it involves a number of pieces of work. And that's right from the start-off point of how we attract and recruit people to join London Fire Brigade, but then once they come into our organisation, about how we identify talent, support talent and identify development. What we don't want to do is be in a position where, say for instance, we come to a promotion round and everyone then scrabbles to think, how am I going to get myself ready? We want that to be a continual journey and a process of people developing, not necessarily for promotion but for their own personal development, you know, to increase their skills and their confidence and their ability. You know, we've got a lot of initiatives now where we want firefighters to be the ones leading those initiatives, so being able to develop their confidence and skills is vital for that. And it is about a whole series of interventions and some of those specifically targeted at some of our underrepresented groups. So, you know, we run workshops for instance, if we're going to have a promotion round, then we make sure that, you know, that if a woman firefighter is interested, we give her access to talk to a woman who's a crew manager, for instance. Sometimes it is just about seeing someone doing the job and asking what can be seem to be, you know, difficult questions to somebody, or questions they wouldn't want to ask to somebody else, and giving them that support in a safe environment. And then, you know, obviously the work we're doing and targeting around our recruitment. I'm very pleased now we've got the results of the research that we promised we were having done in response to the BAME community. And I'm, you know, genuinely delighted to say that we don't see any of the things that came back as barriers as being things that we can't solve. A lot of it is still about the levels of misunderstanding of the role of a firefighter. And I think that one of the things I'm really proud to say that I had a small I told you so moment last week. I try not to do that very often, but where I've been talking about the whole issue around gender neutral language and about people not using the word fireman anymore and only using the term firefighter. Many of you may have seen on social media last week a mother wrote in about her daughter, 4-year-old Esme, who was disappointed that she couldn't be a firefighter because she was a girl and she wanted to be a boy. And on the back of that, I'm delighted about the level of media coverage it got literally around the world. And she's going to come in. So she lives, fortunately, on West Norwood's ground. So, yeah, we are, a woman firefighter is going to go into her Esme's school with her mother to talk about the experience, and then in the summertime she's going to come and spend a day with us, and Esme is going to get to be a firefighter for a day. And it was brilliant, because all the things I've said about the fact young girls are put off and people say to me, no, they're not, Esme was living proof they are. So, you know, that thing for me, we still have a lot of work to do to explain to people that the role of a firefighter is so much more than just turning out on red fire engines, and the whole community engagement, the career prospects, the different roles, you know, the skills, fire engineering, fire investigation, you know, the fireboat, all the different roles you can undertake. And one of the things that I found quite surprising was that one of the main things that came up in our research was that there was a belief or anxiety around the issue of a fear of being hurt, burned or killed as a result of being a firefighter. So actually providing that level of reassurance to people, you know, about how low our level of accidents are because of the fantastic training, equipment, policies and procedures that we have. And a lot of it is just about the myth busting, but also about the positive role models, which is so important for people to be able to see someone who looks like them doing that role. So it's about making sure that in every possible intervention that we're using our role models to promote the role of a firefighter, and making sure that when we go into those communities that, you know, we are talking to them and explaining exactly what the role is. So it's not just about the advertising. For me, it's far more about local targeted focus. So fire station open days, reaching out into the community. So our local crews in conjunction with our outreach teams going into those communities and really explaining what a firefighter means and does and what a fantastic career it is.
No, it's really, really important. And the home visits as well, like I mentioned when we had a home visit just before Christmas and a firefighter's home. My little girl, she's 4, she loved it, and you know, just pressing us that we should get the costume. So it is important. On that, just on the staffing and recruitment, one of the things that's still an issue is that it shows that the figures for about half of your firefighters live outside of London. And again, that was quite evident when I was visiting some of the stations, speaking to the firefighters, hearing that a lot of them are commuting in. Is the cost of living still a big issue for when you're going out to recruit and living in London?
So I think that, you know, the fact that we have, for the time being, relaxed the London residency has shown positive outcome, and we've got more people recruiting. Obviously, you know, there are people who live in London, so therefore there are still target people there, but it is an issue for people, and also it's as much about some people, you know, wanting to be able to buy bigger houses when they've got families. And just that whole cost thing. So we do have a large number of our firefighters who live outside of London. Some who lived in London when they joined have subsequently moved out due to wanting to, you know, be able to buy bigger properties. So it is a deal, but we are constantly monitoring when we get applications for recruitment where they live and what the residency is. You know, ideally we want to recruit London people to be London firefighters, but we also want to recruit the very best people to be London firefighters, and that means giving us the widest pool of talent to attract from and select from.
The cost of housing pretty much comes up on every single visit I make to a fire station, though. As I think it did when we were in Dagenham chair. And I think that that's a general issue, but we've got to make sure that it doesn't become barrier within London, and I think that it's but it is an issue that affects so many public sector workers in our city, and it's obviously something that has broader policy solutions than the fire brigade can solve by themselves.
Mm. No, and it's good that, you know, that's something that we are looking at, and something that the mayor's definitely looking at here as well. Just one last thing for me. So again, I think, you know, there has been a lot of good work on this, and you touched on it earlier, Commissioner, but how we really delve down into why some of the BME communities aren't thinking about joining the service. So again, I look back to the ad campaign that the LFB ran about a year ago, and, you know, I got some of those Facebook sponsored ads on my feed, and, you know, really, really great, and it was just so good to see a diverse range of men and women. Has there been any detailed research into, you know, just looking at why there is still that barrier for, you know, some of those specific BME communities joining the service?
So the interesting thing with the research we did was that we found no specific barriers between different BAME communities. It was all a very similar picture. One of the things that I did find really concerning was that when we went and spoke to careers advisors in schools right across the piece in London, 83% of them had very little or no knowledge of the fire service as a career, and therefore were not recommending it to young people in the school they were in as a possible career. So only 11% of them reported having recommended the fire service as a career, whereas something like 77% of them had recommended the armed services, for instance. So that's obviously a piece of work we need to do to ensure that careers advisors are not only thinking about the role of a firefighter, but understand what it means and understand about talking to it to, you know, young people, both boys and girls, and across all of our communities in London. Because if that first stage where you go to your careers officer for some advice, if they're not putting that seed in your mind at that point, you know, then maybe it's something you don't think about. And, you know, we all have experience of people whose careers advice was one of the first times they thought about what they were actually going to do. So we want to do some targeted work with those people to ensure that they understand the whole range of the role of a firefighter and are talking about it and recommending it.
And can I just say, with the research that was undertaken, that was sort of finalised, I think just before the plenary, actually, I was trying to think whether it was something we raised at the last meeting of this committee. The adverts are great and give a really good portrayal of what we'd like to see for London's Fire Brigade. But at the heart of the research is it's that personal connection, knowing somebody who works for the brigade. Yeah. And actually, I think that's why when we've been doing these targeted advertising campaigns, we've not sort of broken through that barrier, because you've got the image right, and maybe sort of people see it and you start getting a sort of general sense of this is the fire brigade. But it's that personal contact, knowing somebody who works for the brigade, seems to be the missing link. Yeah. So people don't have negative perceptions of the brigade particularly. They don't think they're going to be subject to bullying, racism or harassment. It's the fact that they don't know anybody who works for the brigade. They haven't got that relationship with people who can talk them through, which I think is why the outreach work is so important, because you definitely need to go beyond advertising and actually go to that personal engagement with people.
And that is crucial, because obviously, as you're both aware, during phase 1 of the Grenfell inquiry, some of the participants did comment that they felt that there was, you know, maybe some stereotypes or prejudice against BME people. So it's good that you know, the Fire Brigade are doing a lot to try and dispel that. Thank you, Joe.
Thank you. I mean, I must say the number of our firefighters that have got sons coming in or daughters coming in particular, I completely agree with you there. Can you just clear something up for me, please? The West Midlands Fire Service approach, it's alleged in the newspaper, have lowered the standards for women and BAME applicants to achieve a more diverse workforce. Is the London Fire Brigade going to even think about that?
Absolutely not.
No, good. It's the best person for the job, in my view, and I'm glad you've cleared that up. Thank you. Andrew.
Yeah, I want to come into some of the issues post-Grenfell. Obviously, I'm not going to try and stray into the inquiry, but things have to move on. We can't just wait and see for a report to come out whenever it comes out. So could I start by asking, you've got the Grenfell Tower investigation and review team of 30 people, I think. What's its priorities at the moment and looking ahead?
So at the moment, the 2019 priority going on now is the analysis of the first 7 hours of the incident. So we're going to do that using HSE's HSG, if I only can say it, 65 methodology. So the standard methodology we use for investigation of adverse events to try and identify the immediate and underlying causes. So they will continue to build the timeline, but they now have a dedicated team that are looking through those hours and actually identifying specifics of what happened and attempting to identify any areas for improvement. They're also still collating large numbers of evidence and looking through those. So far, I'll just give you an example of some of the numbers they're piling through. They've had 500 lots of contemporaneous notes, 670 LFB witness statements, 150 inquiry oral evidence transcripts, 392 audio files and 999 calls, etc., etc. And they're just numbers go on. They're also obviously putting together the submissions for phase 2. So we've been asked to provide a large volume of information in relation to various aspects for phase 2 of the inquiry. Some of that is about individual statements from individual people, about actions going back to previous events. A lot of that is around the fire safety teams, and they're providing vast quantities of information. So that's taking up a lot of time ensuring we collate that and get that returned to the Grenfell Tower inquiry in a timely fashion. So they are definitely fully employed with what they're doing at the moment, and will continue to be so for some length of time.
Okay, well, perhaps we can move on to some of the detail now. In the control room, obviously they were completely overwhelmed by fire at Grenfell, and hopefully you don't get that number of calls ever again. You never know. But what have you done to try and change the way the control room operates when you do get a huge spike in calls?
So one of the things that we have done is review the fire survival guidance call policy. And one of the things we've developed from that is the ability for control themselves to declare a fire call to be a person's reported incident. So if they take a call and they believe that the person at the other end of the call is potentially trapped in a building or unable to leave and needs additional assistance, they can make that call themselves. So normally it would be when the first appliance arrived and the officer in charge made an assessment, they would make it person's reported. But now we've given control officers the ability to do that, which is very important. It means that we'd mobilise additional resources, including an ambulance, to the scene immediately. And I'm pleased to say since we started doing that, we've had 63 occasions where control have declared to be persons reported. For a vast number of those, I'm pleased to say that when the fire crews have turned up, it hasn't been an incident that's required a rescue, and they've been able to resolve it very quickly. But what it has meant is the right resources have been on the road and en route to the incident in a timely fashion. We've also changed and improved the way we record and deliver training to our control staff, which has been vital. We've just gone through a new entrance course for 6 people, and they were able to trial a number of additional training interventions and things like daily feedback forms that we'd like to bring out across the whole of control. But it's been really useful to trial it on the 6 new entrants to get some feedback on those. We've also got new development folders for our assistant operational managers that we want to roll out to all our sort of operational managers. And we're also working about the ability for how we can deliver different interventions in training and control, and also how we deliver those training interventions involving operational staff as well, so that we don't just train control in isolation, because obviously part of the issue is it's about the information relay between the control room and the incident ground itself. So working out how we can do that. And we've also given them different training packages to support different critical risks like MTFA issues, so about how to recognise certain trigger points around that when they're listening to calls and what they should do for intervention. So it's a whole broad training package and monitoring, and then looking about how we can, improve that quality of that training for control.
Well, thanks for that. And there's also the issue of coordination of major incidents. What changes have you made there with the other emergency services as well?
So we constantly do blue light training, across the partnership. We use tried and tested models of response to ensure that not only we're sharing information, one of the things we make sure is we've got the information sharing through the control rooms, through a dedicated phone control link, to make sure that, so specifically, the time key critical issues for things like terrorism attacks, to ensure that if one of that comes into any one control room, that the information is passed to the other control rooms immediately, so that we all have situational awareness of what it is we're dealing with. And then it's about the testing and exercising programme we do across the piece, about training together, using our partnership work. So not only our firefighters training on the fire ground with paramedics and police officers, but specifically the officers and the people in charge of incidents to make sure that we use that multi-agency training approach. And one of the things we're doing now, which I'm really pleased about, is whenever we run incident command training for our senior officers, and especially when we do incident command assessments for our senior officers, and not want to give too much of the game away, but we are using real people from real organisations to do that role-playing at an incident. So if we have to have a multi-agency meeting in response to an operational incident scenario, we've got real police officers, real LAS, local authority, and we make sure those role players are in the room so that when a person's being assessed for their operational command capability, they're dealing with the other blue light services as they would for real.
Well, that's interesting. So I was going to come on to command and control, which is one of the issues that's emerged out of Grenfell. And to what changes are you making in the way that the brigade operates? You've talked about something about the training, but at bigger incidents, so group managers and upwards, I suppose. So
we've recently reviewed the way we do so it's incident command level training is by number, so 4 is the top level, 1 is the bottom level, and we've recently introduced an enhanced level for our level 4 people, which is the top level of incident command, but each of them has to go through incident command training every year, and we've made sure that we've gone through and reviewed that training to ensure it's relevant to the risk that we face in London now. And that is very much about being able to respond and deal with not only the operational incident, but the multi-agency aspect and the strategic aspect to understand the whole wider picture of an operational incident. Because, you know, when you come from a fire station, a fire engine level to then go up and take the next level of command, there is a huge step from that about understanding your role, understanding the information you need to share, take in, and the command decisions you make at that point. So not only do we do the training that's supplied by Babcock's, but on the rota groups, so we have 4 different operational rota groups for our senior officers. So when they're on duty at the weekend, the rota groups meet up at the weekend and do weekend training together, because those are predominantly the people they'll be out on the fire ground with, because they follow the same shift patterns, they're on duty at night and weekends together. So they get run in different areas at the weekends, and they go through different operational scenarios, and they ensure that, especially where you get a new officer come onto the rota, they've got that support and development of the more experienced officers. So it's an ongoing process, not just about what we deliver directly to them, but how the peer support works as well.
From what level are you talking about? From station manager upwards or group manager upwards?
Station manager upwards, we do that training.
Yeah. So what proportion of the officers from station manager upwards have actually undergone all the training? Has everybody done it?
Everyone has, yeah.
Okay.
Yeah, officers are, so they undergo training as soon as they become new officers, they undergo the operational assessment to become that officer, and then it's an ongoing evolution of training. And it's not just about the operational face-to-face, there are a huge amount of training packages available on our online computer system that the officers have to undergo to refresh their training across all different subject areas.
And one of the other issues I've raised before, when we're on LFIPA and stuff, is camp-out bases, which were abolished by Brian Coleman, I believe. And to what extent have you brought back camp-out bases to enable senior officers to get to incidents much more quickly?
Yeah.
And I think, from what you were saying, I think Richard Mills was telling me about this when I was in Lincolnshire, about trying to use that as an opportunity also for training. It's
fantastic. I mean, we speak to our new officers who come in, and we've had a recent number of new officers come in transferring from other fire and rescue services, so experienced fireground officers, but not experienced in London, and they found the experience of the camp-out bases invaluable. Because not only are you there as a team in the evening, that when something comes in as a problem, you've got someone to talk it through, but if you then subsequently go to an operational incident, you predominantly go together with that team of people, you work with people you know, you share experience, and they come back, and very similar to the watch culture, they have a debrief around the mess table and have a conversation about what went on and learn from each other. So I'm delighted the camp-out bases are back for that support and development role.
So how many have we got now as camp-out bases, and other plans to have any more?
So the camp-out base at the moment, we've got 4, 5, I think, at the moment. So the largest one probably where we get lots of officers share is Shoreditch, which is great because obviously it's so close to the centre of London. It's really good for response times. We've got one over in Fulham, one down in Lee Green, I think one in Woodside, and one that I can't think of. Where? Acton, very good, thank you, see? Acton, so there's always someone who knows the answer. So they are invaluable, I think, for... And the other thing is that it's great because the firefighters on those fire stations get regular contact with senior officers as well. So, you know, they are in the station, they chat to people, and it's really good. And, you know, one of the things that we want to make sure is that firefighters on fire stations get access to senior officers and can have conversations and ask questions. It's really important.
Has it improved turnout times for senior officers called on to major incidents?
I think, well, it must do. They're in central London, you know. I mean, I think beforehand we did see the issue where people had to provide their own accommodation, and predominantly they were definitely drifting out to the outskirts of London where there were cheaper accommodation available, so it was longer run-in times. So it's definitely a much better resource to have people distributed in central London.
So can I then move on to operational response options, and in particular the infamous or famous stay put policy and evacuation? What changes have you made in relation to that?
So obviously we stay put is not a London Fire Brigade policy. It's based on building design and it's a national guidance. So you know, for the vast majority of operational incidents, we research stay put is absolutely the best advice for people. It's the safest place for them to be. But as with everything else, you know, we will review that in light of the outcome of Grenfell. What we're looking to do is to develop different operational tactics where we want to be able to train our officers to understand when a building is not responding in the way it should respond, and that fire might be developing in a different way than it should. And then we're working closely with our colleagues in the FBU. I didn't know who'd come into the room, so we're delighted to have them here, but working on looking at potentially having an interim solution of a different policy, of a different way, where we realise that a building is not responding the way it would, about how we could do something, for instance, to protect the staircase, because obviously the staircase would be the means of exit for people who want to leave the building, and you know, about how we can make sure that would be our focus and priority. So it is a piece of work we're looking at developing at the moment, about how we can do that going forwards. And it is about understanding that, you know, for the vast majority of cases, stay put is absolutely right, and it gives us the ability to go into a fire and extinguish it when it stays in the compartment of origin. But in those exceptional circumstances, we need to be able to understand how the building's performing and to respond to that.
Do you think that message is getting over to people who live in tower blocks? Because inevitably I think that people will vote with their feet if playing on what you've seen on the TV with Grenfell and so forth.
Absolutely, and you could understand that, couldn't you, if you lived in a tower block yourself, and especially if you lived in a tower block if you knew it had cladding on it. I know what I would be thinking about, so I understand that. And you know, we do know we have a number of tower blocks in London that are on an evacuation policy at the moment because of the fact they still have cladding on them. So I think that understandably people in tower blocks are anxious, and even where they haven't got cladding on, people are still responding in a different way than that which we used to see. But unfortunately that is also resulting in accidents, and completely unnecessarily. So we have had people respond disproportionately to what has been a very small fire in one flat and stayed contained to the room of origin in one flat, but where people have seen smoke or have become panicked and people have left the building, and unfortunately we had somebody jump out of the building completely unnecessarily and cause themselves life-changing injuries of a floor that wasn't even involved in the fire. So we are trying to reiterate and give that level of support and reassurance to people, you know, that for the vast majority of cases, and if your building isn't subject to the evacuation plan, that you are safer staying where you are and allowing us to come in and put the fire out. Because the last thing we want is for people to be mass evacuating buildings unnecessarily and then causing themselves potentially more harm, tripping on stairwells, injuring each other. You know, that would be an absolute tragedy. So it is about trying to provide reassurance, but on the understanding that, you know, people will be anxious. Why wouldn't you be?
I think the point of public confidence is a really important one, and obviously Dany mentioned the fact that stay put is a principle of building design, but it's human nature to sort of take a view on a personal level, not on a sort of purely sort of principle of building design level. And I think that this is one of the reasons why, as well as making sure that the removal and replacement of cladding is speeded up, because I think it remains a scandal, and I do think that if we weren't in the middle of a major political meltdown in the UK, we might actually have had more focus on the fact that the vast majority of these buildings have not had their cladding replaced. And I think it's nothing short of scandalous, to be honest. And then looking at some of the measures that weren't included in the Hackett review, like sort of retrofitting of sprinklers, which we know would sort of both help in these sort of instances, but actually also help to restore public confidence where they are in place. So it's sort of looking at it holistically, understanding why people may feel wary towards a policy that has generally worked, but obviously where it hasn't worked has seen catastrophic failures. It's a bit like sort of fear of flying, really. You know, I mean, they always say you're safer flying than you are sort of crossing the road or whatever the stat is. But the fact is that where you get these catastrophic failures, we actually need to reassure people, not simply by restating the policy, which is generally the right policy, but actually looking at the whole range of safety measures that we really need to see introduced to some of these buildings.
So, well, I mean, you'll get some questions on Hackett when I've finished from Leona. But just going back to what Dany was saying, I think it's something like 150 or so tower blocks in London, of that or magnitude anyway, we've got cladding on. Do the residents in those buildings know what they're supposed to do if there's a fire? I mean, presumably you've got Waking Watch and all these other things going on, regular inspections. I know there's one in my constituency where that's happening. But are residents aware whether or not they're supposed to evacuate or not evacuate? To what extent have they been made aware of what they should be doing?
The residents in those specific blocks that have got the evacuation in process and the wakeful watches have been informed exactly of what they should be doing and then been made aware of the fact there is a wakeful watch and you know that there are specific measures in place for their building at that moment in time. They are of course dependent on the people conducting those wakeful watches to alert them in a timely fashion in the event of a fire, which is why we need to make sure that complacency doesn't slip in those buildings because it's gone a long time. I think, you know, very sadly that people do assume that as time goes on that it's sort of drifts into out of people's memories and people think it just won't happen to them. But, you know, we want to make sure it is very focused in people's minds, that they do know exactly what to do, and that also we've got the right things in place inside their flats. So we're making sure that people, you know, have got smoke alarms fitted. They do understand what they need to do if they need to evacuate. You know, they do have the measures so that people aren't doing things like changing their front doors and things. So we have all those additional support measures in place for those people, as well as the fact that, you know, and until the cladding's removed, that there is a specific policy in place and they do need to leave. And we do also understand that in the, you know, some people are still reluctant to do that. You know, we saw the circumstances in the not too long time after Grenfell where we had all the tower blocks, you know, in Camden where we had the situation where people didn't want to leave because it is their home. So, you know, we need to be mindful they are individual people and we need to give them the right information and support to make, you know, to be able to understand what the risk is to them.
And who trains the Waking Watch people?
The responsible person is responsible for that building, so the person who is in charge of that building, whether it be, you know, a private or a local authority person, are the ones who are responsible for the hiring and training and ensuring that they are doing their job and in place.
Is there a certification scheme for them of some sort? I mean, one of the issues that's come up more generally around all this is having competent people doing things.
Yes, and the competent people has been an overarching issue that we've found across the piece. I don't know if you want to say any more on that, Lynn.
Just to update, the number changes daily. There's around 159 buildings currently that are in simultaneous evacuation. Not all of those are clad, so there's 37 that don't have the ACM cladding on there. The issue around training for the waking watches, when we go in and work with the responsible person and put in some interim measures in place, there will be requirements around numbers and training and the methods of waking residents, should it be at night time or throughout the day. So that's clearly specified in our interim requirements, but as the Commissioner says, it is the responsibility of the responsible person for that building to implement that and make sure that's maintained and updated.
But presumably the brigade doesn't have any role in validating that, you just tell them what they have to do.
We make sure through our station notification process, we would tell them what the requirements are. We would make sure that those requirements are implemented, and then through our station notifications, local crews would visit those premises and make sure that the process is being implemented and the Waking Watch know their responsibilities.
Okay, thanks. Can I come on then to equipment procurement and where we've got to with all that? Where are we with the extended aerials?
So I'm very pleased to say the order has been placed for the extended height aerial appliances and they will start production scheduled with the company in Germany and we anticipate seeing the first one at the end of this year, the first aerial appliance, and I think the first extended height at the beginning of 2020. So as you're aware, it is part of a replacement programme for all of our aerial appliances. So we have the normal height aerial appliance and the extended height. So they are now on the production line and as part of they're in process at the moment in Germany and will be trundling over to us as soon as they are ready, and okay. I'm very excited.
And how long is the replacement programme going to take?
So once we've got the first ones in, it's pretty quick, so it's a continuous rollout programme from there on, and it's about ensuring we've got the right training in place for all our aerial operators. So we'll get the first aerials into London and make sure that all our aerial operators have got the relevant training and then we can bring the whole fleet in.
And breathing apparatus replacement programme, where have we got to with that?
Yes, so the breathing apparatus, obviously that's a slightly longer term programme. We've now separated out the issue of the breathing apparatus communication set away from the breathing apparatus, and we're going to do them as two separate processes because we believe we can get a communication system in place that will work in conjunction with our current breathing apparatus sets and not be tied in something that will have to work with a new one, so we can have something that we can have on a shorter term. But, you know, we've obviously highlighted the issues and we're very aware of the issues of the radio communication problems. So we want to try and do that first. The actual procurement of the breathing apparatus will take longer. So we think it's really important where we can take steps to resolve things quicker. So we have got focus groups. One of the main things we've done is to go out and ask the staff what the problems are, what they want and what they want to see. And we've been working with our colleagues in the Fire Brigades Union as well to make sure we've got the widest reach on those focus groups to make sure that not only does the equipment meet the best technology in the market, but it does what the user wants it to do.
Okay, and what's the timetable for the replacement of the radio sets?
So the radio sets, we are looking at the specification be finalised by May and processed through LFB governance, and then it's just a case of the procurement. And we know that sometimes procurement of operational equipment can take longer than we would like, but I haven't got a final end date on that at the moment, but I can update you with that.
And what about the replacement programme for the command units? Because again, there's an issue about the technology in those.
Yes, so there is an issue about the problem with the command unit, and there's two separate things. There's the physical vehicles of the command unit and the separate procurement of the hardware and the software of those. And we want to make sure we tie all three of those things in together to make sure that we get the new vehicles with the new equipment and the new technology. And we have had some challenges in doing that, but it is something that we are very keenly focused on at the moment. And in the meantime, we are looking at the existing systems we have and whether we can make any improvements to those whilst the procurement process for the new equipment comes online.
And what's the timetable for that?
I haven't got that to hand at the moment. I don't know if you know. So we can get back to you on that. But it's there have been some issues. It has been about tying the hardware, the software, and the physical vehicles in together. Okay.
And then drones. I saw the drones when I was on the exercise in Lincolnshire. No, that's a different bit about drones.
Oh.
The replacement. This is their drones, not the illegal
the
drones.
good ones.
Good drones or bad drones?
Yeah,
Bad
no, I
drones.
was very
drone on, Andrew.
Yeah, I was very impressed with what I saw when they finally got it up in the air in the USAR exercise. Actually, you know, I was a bit sceptical, but seeing what they can actually do with infrared and all that sort of thing. Where have we got to with that procurement?
So, as you know, we're trialling at the moment 2 different sets of drones, and we're looking at how the best option we can have for getting those drones, which we think will be about leasing them, not about buying them, because obviously, you know, as everyone's aware now, drone technology is changing day by day, and what you don't want to do is end up buying your own equipment that becomes out of date within 6 months. So I think we come to the end of the trial within a couple of months. We've been delighted with you know, not only the use of them, but the wide variety of use of them. So, for instance, the fire on New Year's Eve at the storage centre not only was able to give the officers very good situational awareness, because obviously those types of buildings are very difficult, but it became very clear very soon how very close to the tram line the fire was spreading to, and it enabled us to inform the transport people very quickly they probably needed to stop running the trams because they were going to be at risk. And we've also been using them quite a lot for partnership working and training with things like water rescue and the ability for them to go up above water with the thermal imaging and identify people in the water, and right across the piece for all different operational incidents we've had them up. So I think we took them down with us yesterday to assist with a large animal rescue that we were helping cross-border with. So they have been, you know, used very widely. So we will definitely be getting drones. It's just looking at the best way of procuring them and maintaining them. And then, of course, making sure that we have the right people licensed to fly them. And that it's the method of the people getting them to the fire ground and making sure we have that on-call system.
So what timetable are we working to for that?
So I'm hoping the paper is coming to Commissioner's Board, I believe, in March for the decision process about which route we go to take for procurement. So shortly after that, we'll be hoping to go out to market. And because we're not actually buying them, we're going to lease them, it'll be a quicker time frame.
Okay. And the last thing on equipment, I saw this at Morton last year as well as on the Lincolnshire pump that they were demonstrating at the USAR exercise. Is it called a javelin? This thing where all
the ability to be able to pierce through, yes. It's the Lance technology.
Yeah, that's it, the Lance technology. Yeah. Are we going to get those? Because if Lincolnshire are ahead of us, that makes me very worried.
We'll never let anyone get ahead of us. No, so we are looking at those at the moment. We do have 2 sets of them in London on trial for specific operational response at the moment, and it is something we're looking at. They are a very good piece of kit, especially in helping for firefighter safety, for being able to... so just for people who don't quite understand what they are basically a long spear, effectively, that has the ability to bore through walls with a mixture of small bits of grit and water, and then put high pressure lance into a room or a compartment to be able to suppress the fire and make the conditions in there much better for not only the people in the rest of the building but the firefighters going into there. And they've got a number of different uses we can have them. So we have some on test at the moment, but it is something we're definitely looking at as part of our ongoing firefighter technology package.
And what's the timetable for that?
The ones we have on test at the moment we've had for about a year, I think. We've had them out on a number of incidents. And one of the things we think they'll be really useful for, as you're aware, we have a number of large-scale like warehouse fires that we can't get into the warehouse because of the design of the warehouse. It's too dangerous to commit firefighters and there's no life risk. But, you know, to be able to punch through the walls there would be good. So I think the trial goes on for about another 6 months, but I can get back to you with the details of that.
Okay. And then the other thing were the big fans. So.
Big fans, yeah. Positive pressure ventilation.
That's it,
yes.
Yeah.
Seems all simple to understand what they are. Yes, those are also a piece of kit. We have one set of those in London at the moment. And the key to those is about the training that comes with it, because obviously not only can they make conditions considerably better, they can make conditions considerably worse. So it is about ensuring that we can use them for the right situation, and it is about making sure that not only is there an entry path for the fan, but there's an exit path for the air you're pushing through the building, and that you're not pushing the fire through the building, especially if there are people in there. So we have, as part of our operational policy, a whole range of equipment we're looking at, all to do with improving firefighting technology and firefighter safety. I suppose it might be useful at some point, probably when the weather's a bit warmer, to set up a show and tell, if that would be helpful to the board. And we can have all the equipment and we can show you all the technology we're looking at, if that would be useful.
Yes.
And what's the timetable for positive pressure ventilation?
It's something we've got. I haven't got the exact timetable, but it's definitely part of our on-trial package now. But I can get you the package of the whole suite of things we're looking at and provide you with that information, if that will help. Okay, thanks.
Okay. And the last question you asked me to do, actually, was on the Centre of Assurance,
yep.
Which on the whole is a pretty positive document, I think. The only question I had was on page 18 of the performance data document, which is fire safety audits and inspections, where the trend looks a bit downward. And I wonder if we could have an explanation of what's going on there. Looks like that.
Those things that one hand.
Page 18. The Statement of Assurance
I've got the
picture document.
Page 18, did you
Page
say?
18, yeah.
Yeah,
Page 18.
Right, I've got the picture document.
Page 9, yeah, page 8. Page 18, yeah.
Got page 18 in mind. So,
can you assist taking it?
let's just make sure I'm looking at the same document that you're looking at.
Yeah.
I've got lots of things that I kind of think it looks like that. Yeah.
Looks like that on the front.
It is, yes, I've got that. Okay, I'm looking at that. Yes, so sorry, okay, question comes.
Regulatory fire safety.
Yeah.
The fire safety audits and inspections has been on something of a downward trend by the look of it. And I wondered what that was all about and why.
So I think that, you know, there has been a fair impact from Grenfell because we've had to obviously focus our priorities on different areas, which has meant that some of the normal scheduled planned visits have had to be postponed because we are responding to a pressing need and priority. It is something that the fire safety team are aware of and are working towards now, but it is about ensuring that we've also got new mobile working devices, which is a new piece of technology which will improve systems in the future, but also the rollout of those and the training for those has meant that we've been making sure that our fire safety officers have the right equipment to go with that. And there is still an issue, and let's be candid about this, about numbers of fire safety inspecting officers and getting the right people in place and having the right training and having the right competent people, and that we are working very hard to ensure that we support our fire safety staff, because unfortunately there is a huge magnetic pull from private sector for our highly trained and professional staff, and some companies that are willing to pay vast sums of money for our expertise, because there is obviously a massive gap in the market at the moment, and that is one of our concerns, is about people in fire safety. And, you know, I'm lucky that I have an incredibly dedicated professional bunch of fire safety professionals who want to work for London Fire Brigade, and their sole reward isn't about finance, which is just as well, because they could go and considering more in the private sector, but they are very keen on working for London Fire Brigade and working for the people of London. But those issues, together with, you know, staff, Grenfell, and to do with some of the new technology, have meant there has been a dip, but it is something that Lee and his teams...
I can cover some of that for you, Andrew. So you're right, there has been a slight reduction in quantity, and some of that work is due to the fact that we're increasing our quality of inspections with the lessons learned from the high-rise task force. So that's highlighted a number of issues, and actually when we're doing that higher quality of audit, what we're finding is that our enforcement rates are going up. So the number of notice of deficiencies that we're issuing and our enforcement rates are going up in the region. Our notice of deficiencies are around 20% now. So whilst our numbers of audits are going down, we're actually better targeting and focusing and reducing risk in those premises that we're going in. So those audits will take longer, and that enforcement process takes longer.
Okay, lovely, thank you. We're moving on to the Hackett review now, Leanne.
Well, the post-Hackett implementation plan. And I just wondered if perhaps we could start with you, Deputy Mayor. What is your response to the government's plans around Hackett implementation? What do you welcome, and in what areas do you think it could be stronger?
I think that one of my main concerns about the implementation goes back to the point I mentioned earlier about the need, well, not just for central government, but the need for government to actually sort of get on with some of this a bit faster. And I think that there was a lot of pressure on Dame Judith Hackett to complete the review, and then it took months and months, and there were loads of delays to actually getting an implementation plan. So I think a lot of what is in the report is very positive, but it will only be positive and create the changes that are needed if we move on from sort of consultation on things to actually sort of properly seeing implementation, seeing the removal of the flammable cladding, ASIM cladding, seeing the sort of work going forward, looking at how the new approaches will take place. So we've got the joint competent authority, so how's that going to work in practice? That's still unclear. Still unclear how resourcing for that will work in practice. And I think that it's also, while a lot of the things are really welcome, we've still got the concern around the lack of clarity on the future threshold of high rise, and we've got issues around sort of the sprinklers not being mandatory in sort of lower buildings. So I think it's over 30 metres there. Compulsory, is that right? 30 metres?
The Hackett recommendation is 10 floors and above.
Yeah, so it's just about sort of, are they strong enough, and are they going to go far enough in the future? And I think the retrofitting of sprinklers, which some of our councils have implemented, can deliver quite a lot of benefits. But we need to go beyond residential high-rise. We need to look at care homes and hospitals and sort of schools, and how we actually make sure that we put the whole suite of fire safety measures in place, and actually make sure that we really do learn, that we do see proper implementation of the Hackett Review. I mean, the Fire Brigade worked really closely with Dame Judith and really welcomes a lot of the recommendations. But unless it's implemented, we'll get another situation again in which things can go wrong because issues that have been identified aren't addressed sufficiently.
So is that something, I mean, really, you seem to be saying it's great to have an implementation plan, but now we need to work on the implementation, not so much just on the planning. Yeah. Would you share that view as well, that we need to be getting a bit of a wriggle on with actually addressing some of the areas? Generally, you welcome it, but let's do some implementation.
Yeah, I mean, we recognise the fact this is an absolutely once-in-a-generation opportunity to bring in those changes And I think that, for me, if we haven't learnt the lessons and moved forward from Grenfell, then it's a tragedy, because if that wasn't the biggest wake-up call for everybody to understand that changes need to be made, then I don't think, that we... I think it would be such a missed opportunity. And it is, for me, about ensuring, predominantly we welcome everything that's in there, and we're very pleased to see that many of the recommendations that we put forward have been included. But, we need to focus on the highlight about the issues. I was just talking about skills in the sector and ensuring that we've got the right number of skilled people who are available, not only to work with inside places like the Fire and Rescue Authority, but to work within places as responsible people, and people that are actually providing the information and dealing face to face day in day, and also being very clear about who is responsible for what under fire safety legislation, and also increasing the role of fire safety and the safety of the fire service and safety of buildings. We think is vitally important, and we have a role to play there. But the issue of sprinklers for us, we've campaigned for years about it, and we want to make sure this platform, this opportunity is not lost. And it isn't just about, for us, about the high-rise buildings. That is absolutely key and important. But it is about areas where vulnerable people are. And that does include sheltered accommodation. That does include care homes. And those aren't just buildings of 10 floors and above, So we need to make sure it's focused on all of those areas. And absolutely places like schools, where it isn't just about life risk, but about the whole impact on society when we have a fire in a school that could so easily have been prevented, the fire spread, by some form of fire suppression or sprinkler. So I think this is the start point. It's a very good start point, but it is about keeping that impetus up, keeping that focus going. And I'm really delighted with the amount of work London Fire Brigade is doing nationally on the campaigning and support for this, because I think we do have a key role and responsibility to play, and we do have such a highly skilled workforce who are able to work going forward on this planning, and just to make sure that the momentum is not lost and we keep pushing forward with these key initiatives.
I'll come on to resources in a minute. One of the concerns that I have, and looking at a lot of the local authorities have been digging into this in a big way, and you referred earlier on to the fact that Camden had decided to, after Grenfell, evacuate an entire estate with lots of people. How are you finding engagement from private building owners and also from industry? Because I understand RICS have some concerns, and they've actually called for some changes in the fire safety regulations. Would that be helpful? And also, what's going on in the private sector?
So we are working close to the private sector, and we are engaging to ensure, and what we need to do is we're still waiting for the results of some of the testing on some of the privately owned building about the cladding, and I won't actually seek to delve and comment on the detail of fire safety regulation. I might pass to my colleague because it's not my specialised subject, but I know that we've got 87 private blocks in London at the moment that have got the temporary simultaneous evacuation strategy. And we think
87 private
87,
blocks.
yeah, that we
I
know of at the
understand there's
moment.
137 residential tall buildings as at the end of December that have, been identified as having the ACM cladding. And is there some sort of plan in place for dealing with them all, or at the moment we've just got arrangements in place to?
I can take some of that for you. So some of it is around the legislation and the pace that goes through. So, and being clear who the roles and responsibilities. So a lot of this falls under the Housing Act. London Fire Brigade's position has always been that we can't enforce it under the regulatory reform order. And then recently, local authorities have been calling for some time to a change in their housing health and safety rating system. That has now been laid in Parliament, and that has now been passed. So that was implemented on the 23rd of January this year, which means that joint inspection teams can now go out, and that is happening nationally. We're waiting for some of the feedback of that, because you've got joint teams from Fire and Rescue Services, Health and Safety Executive and local authorities going out to enforce on the removal of that cladding. And London councils, we've been working very closely with their teams around that, with London councils, to put a team together around doing that within the London area.
Okay, so in terms of the resource implications, however, do you feel that we are, I mean that sounds like quite a large resource implication. Do you want to just outline overall the impact on the brigade? You also talked about us assisting brigades elsewhere.
So it has been a huge impact on our resources. I think that we recognised very early on that London Fire Brigade have the expertise and we have the staff available, and therefore we felt an imperative that we should be, where we can, assisting other fire and rescue services to ensure that not only are they, have the right advice and the right support, because some of them, their fire safety teams, might be 2 or 3 people to cover the whole of their fire and rescue services, because of the nature of their numbers of staff. So it is about us being able to do that, but also it's about the influence we have, that we've been working on supporting, the Hackett Review and the expert panel and the work that falls out of that. I now have 2 members of my team fully embedded in that, who are providing that day-to-day support and ensuring that the right information is there going forward. Whilst that's, to another big drain on London Fire Brigade resources, it means that we are in the right place to provide that influence and support. And to look at, we help develop the government's interim measures and all of those aspects where we can have a really key influence on the development phase of it, which is very important. But that does have the toll of taking them out of the frontline day-to-day workforce, and also the ability of us to, be able to make sure we've got the right trained staff, and about that, we are bringing the right people in and giving them the right support and development to be able to undertake those very specialist roles. There is also a piece of work that we're undertaking about how we provide more additional training and support to frontline firefighters so that they can share that workload, so that when they're going out doing their routine daily inspections, that they can then enhance those inspections to be able to start looking into other matters. It is something that used to be as part of the role of a firefighter many years ago, and then obviously legislation changed. So we want to make sure that we're in the right position, because it's very important that our firefighters have the right training. When people say things like, can't you tell what a fire door is? The vast majority of people couldn't look at a door and understand what a fire door is. It's about understanding what that is, and it's about, looking. So we can all understand basic safety measures, but it is about, when we're in a building, making the most of that opportunity. If we're in there inspecting the dry rising main, for instance, to make sure that that's functioning, that we can identify where there are other problems. But that is about the right support and training for our firefighters, as well as making sure that our very dedicated fire safety specialist teams have the right resources and numbers of people to not only respond to things like whatever comes out of recommendations, but also to do our normal day-to-day workload.
So how helpful has it been that the Mayor decided to increase the allocation of resource to the Fire Brigade?
Oh, very
through
helpful.
the budget. Do you think the additional workload that you've been taking on, could that have happened without that additional resource, do you think?
No, definitely. It would have been very difficult. It would have meant there'd be other areas of work we wouldn't have been able to complete, and it would have been about how we decided what to do and what not to do, and we don't want to be in a position where we're not doing essential frontline fire safety work.
I'm glad to hear that, because obviously I supported the additional resources coming to the Fire Brigade, but some people had other comments about them. I'm very pleased to hear that we're not just looking at the over 10 stories, because that is a point that I've raised a couple of times, and actually we had an interesting discussion about what would happen if the ground level around a building then suddenly made it less than the height or the number of stories, because something had changed. So I think that's really good that we're digging into that. Can I just ask you about the task force and the National Inspection Team, which is supposed to have been implemented by the government to speed up looking at the cladding on the private sector buildings? Has that now been set up, and how is the work going on that?
Well, some of that work is referenced in that change in the housing health and safety
so
rating
from the
system.
23rd?
Yes, so now those teams...
Okay, so last week, basically.
Yes, so now those teams are out and looking to enforce on removal of cladding and remediation. But there is still some gaps, because the government has also commissioned some testing on other cladding systems, so there's still a question mark on what they're going to be replaced with. So some people are waiting on some of that.
Okay, so that's a new update from last week. So that's good to hear that it's moved on. Slightly disappointing that it's taken until January 2019, which is, well, more than 18 months since the original incident. So I think I'm probably with you, Deputy Mayor, in terms of, we need a bit of focus to continue to move this forward. You referred, Commissioner, to the issue about skilling people up. Is there still a skills gap, would you say, in the fire safety team that needs to be addressed, and what can we do to address it?
Yeah, so what we did decide very early on was that we weren't just simply going to recruit numbers into posts, because it was about having the right people with the right skills and training. So the process of recruiting those people has taken longer than ideally we'd have liked, but that is about very much about us getting people in and then providing. So to train a fire safety officer isn't obviously something that can be done overnight, so it is about ensuring that we get those people and give them the right access to the levels of training, support and development to enable them to go out and do those fire safety inspections. So it is an ongoing piece of work, but we are competing against market force at the moment, and people aren't necessarily always attracted to come and work for us as fire safety inspecting officers when there is more money in the private sector, and that's something we battle with. But it is then about us making sure that we are attracting people who have that public sector ethos and who very much want to stay with us, and then about ensuring we give them the right development support once they're inside and working for us.
I mean, obviously, some of the people who've been sort of business critical in the past, certainly I can remember when I was a young housing officer and discovering the delights of what an intumescent strip may or may not be. I can't even believe I can still remember that word. But, you know, obviously working mainly with people from, not just from the fire brigade, but also from people from building control and the building standards teams in local authorities. How are you finding the level of staffing there of people? Because I believe they've also got the same issue about private companies also attracting staff more extensively, and also with budget cuts to local authorities, some may just have decided to downscale. How's that going?
I think that is an issue across, you know, the whole market force for that area of it. And I think one of the things that did become evident after Grenfell, and it was something that was had a conversation about, especially in relation to the issue at Camden as well, was about then getting the people, responsible people, who wanted to commit and to basically sign their name on documents stating whether or not buildings were or weren't safe, and whether or not the right safety checks had taken place. Because I think prior to that it had been an industry that had been potentially not as well regulated as it should have been, and that people had, you know, made considerable businesses out of you know, working in that market, and suddenly there was a realisation of the level of responsibility that when it went wrong, that, you know, the person who signed on the dotted line was the person who was responsible for that. So I think there was a whole big piece around understanding the role, levels of responsibility, training, and then the private sector suddenly realising they had a whole piece of work to do and they could increase their offer to those highly skilled and trained people. So I think it has affected, it's not just about affecting fire services, it is about affecting the whole of local authority. And I think there have been times, like in everything, where budget cuts have come along and some of those teams have seemed like an easy team to make reductions in. And it's not until something like this and a tragedy happens that people then refocus their priorities. And I think that's, you know, how it happens with every single major event that happens. People suddenly realise what is and isn't important.
Well, yes, I mean, we also had the now rather poorly titled bonfire of red tape, which freed up a lot of the inspection regimes to bring in the private sector. And, you know, obviously that was all extremely onerous health and safety inspection regimes that perhaps now, with the benefit of hindsight, some of that bonfire may have gone slightly too far. I just also wanted to ask you, you were talking a bit earlier on about residential buildings. How many have had their stay put suspended and some sort of evacuation policy put in place? Is that something that you're able to tell us? If you can't, perhaps you can write afterwards and give us the figures.
I can cover that. The up-to-date figures are 159 high-rise buildings in London don't have arrangements in place that would suit a stay-put policy, so they have gone to simultaneous evacuation. As I said previously, 37 of those are not because they're clad in ACM.
So just 7 is not due to cladding?
37 is not due to
30% are not due to cladding.
37 numbers.
Right.
So they have simultaneous evacuation in
But
place.
the others are due to the cladding?
159 less 37 are clad,
Okay.
yes.
There's been a call from the Trades Union Congress, the TUC, and several others, including some in my old, number of my old professional contacts, for flammable cladding materials to be banned on commercial buildings. Do you think that's something that the government should be pursuing?
So I think that, you know, it's been the point that was made, I think, in the Dame Judith Hackett review as well, is that simply banning ACM cladding isn't the answer to everything, because it needs to be as part of a number of measures. Obviously, we don't think that flammable ACM cladding should be put anywhere. It is not, you know, an ideal covering for a building under any circumstance, whether that be a one-storey building or a 30-storey building. But it needs to be recognised in a load of other measures, and very much the point that we maintain the rest of that building as equally as important.
So, sorry.
Oh, sorry. Yeah,
So I was just going to say, it's also about prioritising life and making sure that where people are vulnerable or where people are sleeping, you absolutely prioritise that. So I think I totally agree with the Commissioner that ACM cladding shouldn't be put on buildings, but actually if a ban was to come in simultaneously across all building types, then you wouldn't necessarily get the a prioritised replacement of the cladding. So I think it's very easy to say ban it on everything immediately, but actually we really need those buildings that still haven't had their cladding replaced, that we know people live in, that they've maybe got the one staircase out. They've got very different fire measures to an office block where, for example, here we do have sprinklers. So, you know, it's about sort of prioritising and actually sort of really identifying where we need to do it first. And I think that the immediate ban everywhere would be a bold political statement, but actually it wouldn't address the hierarchy of sort of risk.
But presumably in buildings that are going to be constructed, though, yes, I can see nodding. So in terms of the government's consultation on approved document B, what are the kind of things that the Fire Brigade is going to be calling for?
So we submitted our response to the approved document B. You know, we are very keen. We are definitely very proactively pushing the sprinkler and fire suppression agenda because, you know, absolutely that is an intervention that we know saves lives. And I think that, you know, that other, you know, Scotland and Wales have taken bolder steps than we've taken them. You know, I think that it would be a great recommendation to ensure that they are installed at the point of building. And I think, and for me, one of the things that's a sense of frustration is that the price of installing sprinklers at build point is, you know, such a fraction of the cost of the development of building, and yet the amount of money it saves in the longer term, you know, not just about the finance but human life, you know, it's just for me in some ways a no-brainer. So I think that, and I know that I did a piece of work recently around schools and sprinklers, and just the comparison in two adjacent boroughs of where one borough had a school that was sprinkled and had a fire and it was contained to the classroom of origin. They closed that classroom, redecorated it, and within 3 weeks it was open. The rest of the school had minimum disruption, and an adjoining borough, a non-sprinkler school that had been built about the same time, burnt down. The children had to be relocated. The inconvenience to the children, to the families, disruption to education, disruption to people's lives, you know, and the whole situation from that. And for something that at build cost, you know, can cost as little as the price of carpeting a building. And for me, you know, we want to keep up the pressure and absolutely keep that at the forefront of an agenda, because it is about safety first and foremost. And also, when it comes to the fact there is a fire, it's then also about the safety of my firefighters responding, because obviously a sprinkler building, going into that where the fire is starting to be extinguished is far less risk than going into a building that's with a fully developed fire.
I completely appreciate the points that you're making about the need for us to focus on human life, but I think all of us were really quite shocked by, and actually it was really heartbreaking listening to the people who pretty much lost everything in the fire in the Shergard self-storage facility in Croydon. And I actually spoke to the borough commander in Merton, who had been there along with Merton firefighters. And, you know, one of the... I think that is a very difficult situation, because you're hoping that there's going to be no one inside it, because it's not... It is just meant to be self-storage. But, of course, until you're absolutely sure that there isn't, you can't... You know, it's very difficult to know what to do. And a lot of them, I think, aren't necessarily very well laid out for easy access or dealing with the fire. So once it starts, I can't say I've spent my life visiting them, but those I have visited, I've always felt quite... you know, difficult and tricky places. And it also took up the time of 120 firefighters and numerous appliances who were then dealing with that particular incident. Do you think that the fire safety standards in self-storage facilities are something that need to be reviewed? Because there's an awful lot of them everywhere now.
As I understand it, and I will stand to be corrected by my expert to my left, there are, it depends on when the buildings were built as to what the regulation and the requirements were and the use of the building. But I think for me, that, you know, those types of buildings and the way they're built and the sandwich panel construction means that they are relatively quick and easy to put up. That's the design of them. But equally, very much rightly as you pointed out, for response for firefighters are very dangerous buildings. And whilst we would like to assume that there's nobody in them, they're 24-hour access. You don't know that somebody hasn't suddenly remembered something they want to collect out of there and hasn't gone into that building themselves and been overcome with smoke. Or, you know, heaven forbid that, you know, in less well-regulated ones, somebody might be trying to sleep in there because it's somewhere warm and dry. So for us, there is that risk, and we don't always have the ability to be able to detect whether or not there are people in there. And that for us is a key concern, and was a key concern on the night. But when the fire spreads beyond a certain point, it is a very dangerous structure for us to go into. Along with the fact it's very heavy fire loading, and we don't know the contents of that. And although people sign up to say they're not storing anything of a hazardous nature, there is no inspection on what goes into those premises. So for us, there is very much the aspect of firefighter safety and fire spread. And unfortunately, because those buildings are designed to keep the rain out, once the fire's going inside, it's very difficult for us to get water into the building through the nature and the design of it. So it does become, if they are not sprinklered, once the fire is well developed, it is exceedingly difficult for us to do anything other than stand around and protect the surrounding risk from it. So and I understand that there are numbers of measures being looked at. You know, so we won't comment on the Shergard because that is an ongoing investigation at the moment in its own right, both from our fire investigation teams. But I think as a general principle, buildings like that, not only for the safety of people going into them, members of the public and ourselves, but for the protection of people's possessions. The ideal would be that there would be sprinkler measures in them because, people are expecting if you pay money to store your goods in there, that's where they'll be safe.
Okay, that's good to hear. I mean, I personally think that we do need to try and do something to regulate them a bit.
Can I say on the point about Shergard, I met some of the customers, and I think it's because they're anonymous buildings, I think it's very easy for us to underestimate the impact of a fire of that type, and I think that it is something that needs reviewing. And actually, as part of the follow-up to my meeting, the Mayor's written to Nick Hurd asking for a review of the regulations and the rules around self-storage, because it does appear there's quite a lot of variation in quality of the self-storage units, and I think there's been two major sort of self-storage fires in London in 2 years. So, I was shocked to learn that actually 40% of all the self-storage in Europe is in the UK. So it's a big issue, particularly where people are storing items of hugely sentimental value.
Yeah, there's been a huge growth of these units all over the place, absolutely. Well, thank you very much for that, Deputy Mayor. Finally, I just wanted to ask something about the Fire Brigade's pilot of fire station checks, the initiative about familiarisation with site visits. Has that been going well, and what additional expertise have these visits been able to draw on and create?
So what we've been doing is doing some joint visits by fire station staff and also fire safety teams, and a large number of those have been about providing reassurance, which is vitally important. We talked about the communication piece earlier, and that people do need the right information and reassurance, and sometimes it's as simple as being able to to actually go into buildings and to have that conversation with people about the premises they live in, and safety measures inside, and doing the basic checks for people. We've also been doing a lot of work with building owners themselves, and part of that is about providing support and guidance to the building owners, but also about checking that the information we have about the buildings is correct. So it's kind of two-way sharing. So I think they're very useful, and sometimes where we've had the inspection with our fire safety officers, we've had implemented interim safety measures in those buildings. So some of those have been about us talking to them about things like the simultaneous evacuation strategies. And I think for us it is very important about how much support we can give working alongside the people to ensure that the building owners have the right advice and the people in the building have the right advice. So I think overall, as an advice piece and a reassurance piece, they are working very well.
Thank you very much. Thank you, Chair.
Okay, thank you. The next little bit is on collaboration, but we can be brief because our next whole session is on collaboration. So just as I say briefly, how has the London Fire Brigade changed the way it works for the London Ambulance Service and the Met in recent years?
So one of the things that we do on a regular basis, I meet with the Commissioner of the Metropolitan Police and the Chief Executive of the London Ambulance Service to make sure that collaboration is at the top of our agenda. And we have a signed up statement that the three of us have signed up to about working collaboration. What we've all been very clear about is that we want to make sure that the collaboration is for a purpose and to achieve better public safety and to achieve better outcomes, and that we're not just being seen to collaborate for the sake of it, and it must have a output and a purpose and a reason for doing so and working together. And I think that we've realised that some of our best achievements are by doing some low-level work, some very specific targeted work, and then some general piece about looking at things like estate strategies together, and actually looking wider across London as well. So it is about ensuring that we are looking at all different levels and working together. And it's not just for me about working with other blue light partner agencies. It's very important we're collaborating with other parts of the GLA family and also collaborating with other fire and rescue services on procurement strategies. So the new PPE we've procured has been as part of a national procurement strategy. So I think for me collaboration comes in so many different shapes and forms. And a really good example is some of the work about the corrosive substance attacks that we've been doing. So that came out of a homeborn initiative of our local firefighters in East London who are responding to an ever number increasing corrosive attacks where people were having unknown substances thrown in their faces, and realising the importance of developing a training package to work with people like transport providers. And I had an update just today about the work they're doing with not only the Met Police but with the City of London and British Transport Police about providing training for them in the initial response and how to deal with the results of a corrosive substance attack.
Yeah, I think there's so many different areas and I'm a massive supporter of it. What would you say were the main barriers to collaboration across the blue light services? Just very briefly, because we're going to look into this.
Yeah, so I suppose it's making sure that we have got the right governance and oversight across the piece, which we are making sure we have set up. And so London Fire Brigade are currently housing the oversight for the collaboration inside London Fire Brigade to make sure that we are not duplicating work and that we're not doing unnecessary work. I think that some of the barriers just are our own imagination about what work we can do and making sure that across every piece of work we do, we are thinking whether there's a collaboration opportunity, whether that's procuring something, providing a service, or whether it's about us being able to provide, a support service to another organisation. So I think it's just about making sure we all have the right commitment and intent and making sure it goes through a proper governance structure to ensure it's for the right reasons and we are monitoring the outcomes to ensure that it's positive.
All good news. Thank you very much. So last but not least, Keith, we come to drones.
Thank you very much, Chair. Question for the Deputy Mayor. Obviously we spoke earlier about what I would call friendly drones and what a benefit they are to us all. I'd like to have a chat now about criminals who use drones. And we've all saw in the news the disruption caused by undesirable people on the airports. So for the Deputy Mayor, what concerns do you have about the increase in use of drones by criminals or criminals?
I think I'm sure everybody in the room is concerned about the increased criminal use of drones, and I think I take the threat of the criminal use of drones very seriously. As the Commissioner mentioned, one of the problems is sort of the flip side of her point about sort of leasing rather than buying. The technology changes very quickly, so it's something that people need to keep on top of. It's not going to be sufficient for people simply to buy one system and never review it because the technology moves so quickly. And I think the incidents before Christmas at Gatwick and in early January at Heathrow were very concerning. I'm aware and I'm confident that London airports are taking this very seriously, as you can imagine, and are looking to invest in new anti-drone equipment. And I think this is welcome, and the London Resilience Forum, which I chair, will support them however we can to combat the threat. We've asked the MPS to provide a specific update on the threat to security from drones at the February meeting of the London Resilience Forum in a couple of weeks' time. So that's where we'll get our main update on that. But as you suggested, it's something we all take very seriously.
Yeah. So obviously there is a role for London Resilience in planning and also disruption and so on. Has London Resilience actually assessed the potential of these impacts? Is London Resilience doing its own piece of work at all?
It hasn't. Sorry.
That'll be your pager.
It hasn't yet, and I think that the report by the MPS at the next meeting will look at sort of whether this is sort of something that will add to the piece. The threat of drones generally is looked at through the Protective Security Office within the MPS, and they give specific advice or specific advice provided by the Centre for the Protection of National Infrastructure. So this is the forum that would have that discussion that takes place, and actually it's obviously quite sensitive. There's huge security implications around some of the issues around airports, and a large part of the work that the Resilience Forum would undertake in the event, and we're very, in some ways, fortunate, I can't use the word fortunate in relation to any sort of interruption of services of the kind, but as you saw from the incident at Heathrow, it was of a much shorter duration. I think where the London Resilience Forum's work would kick in an incident of this kind is helping with the response rather than necessarily sort of the measures that you'd expect an airport to be reviewing and looking at themselves. So it would potentially look at sort of the impact of the response and how they would help support that, maybe through humanitarian assistance with the numbers of people that might be stranded in that sort of situation, working together in partnership to try and address the issue. But I think that it is something that the Resilience Forum is taking very seriously, and we'll be looking at what work we might do on that going forward.
Because I don't have any doubt, Deputy Mayor, that you do consider this to be a serious matter. From what I've heard, and I may have misheard what you said, the impression I'm getting is that you are obviously quite rightly looking at what other agencies are doing and looking at the impact and the outcomes of what other agencies have done. But do you not feel that perhaps, as you are the Deputy Mayor for Resilience, that maybe you should bring certainly those members of the GLA family together to do a piece of work around resilience in this issue?
I think that the general issue of drones and the threat that drones pose is something that would be worth doing a piece of work about. But the responsible agency in terms of the protective security around the issue of drones already sits within the MPS. So I think that this is why we've asked them to come and talk to us at the London Resilience Forum, and it's in 2 weeks' time, and I think we will look then at what work would be relevant for the London Resilience Forum to do. That isn't to say that the GLA and the London Resilience Forum don't take it extremely seriously or think that there's a role for them, and actually with the drone incident at Heathrow, there was London Resilience closely monitored the situation and was in conversation with officers at Heathrow, and City Hall was also sort of engaged in that monitoring process, and I'm absolutely confident that had they needed to step in and assist, they would have done so, and the Mayor was briefed on the situation and actually spoke to central government and the MPS about it.
Yeah, please don't misunderstand me. I do accept fully that you do take the matter very seriously and you are concerned about it. I also accept that in relation to security, that is the role for the MPS, not yours, because you're not responsible for security, but you are responsible for resilience. And the point I'm trying to get across is that there may be an incident. Let's say use Gatwick. It's probably not a good example, but let's use Gatwick as the example. There is an issue there, but there's a lot of fallout as a result of that. So obviously there's the security question, which the police and the army have dealt with, but as the Deputy Mayor for Resilience, there's a lot of resilience issues as well. And what I'm asking you is, what consideration have you got or given to what mitigation you can take in the event of a similar kind of event occurring as a result of drones. Because there's the resilience, that's about mitigation. That's about your area really trying to lessen the impact of such an event, not the security of it, not the prevention of it, but lessen the impact. So, like, I hate to use the example, like the Mayor is doing work around Brexit, so that if that happens, if we have a hard Brexit, he can mitigate the fallout of that. Bad example for me, but in the instance of a drone incident in central London, have you done any modelling, or are you thinking about doing any modelling to offer resilience and mitigation around that?
The MPS is coming to talk about the issue at the meeting in 2 weeks' time, and I wouldn't want to preempt the discussion or undermine the discussion of the London Resilience Forum by preempting any sort of outcomes of that. But the Resilience Forum is a partnership of organisations who respond and help sort of the strategic response to issues. And I think that it would already be well placed to help a response in any sort of situation such as that. But the issue as such, and that sort of the issue of drones itself, is owned by the MPS. It would be the response and the sort of response to any incident that the London Resilience Forum would take part in. But I think that we do have a number of strategic coordination summits that look at specific issues, and for example, quite often these will look at issues. So, for example, there was one in the autumn that looked at chemical, biological, nuclear, radiation and explosive attacks, and looked at the implications of that. So this would come in the sort of category of the kind of issue that they would test the general principles and protocols of how the partnership operates with a specific scenario in mind.
Yeah, just because it is a new kind of threat, so all the processes that you currently have may not allow for all the possible contingencies that may be needed, because it's a different kind of threat. But I'll leave it there, because I get what you're saying. And obviously after you have the meeting of the forum,
no, absolutely. And I think it is something that is new in the sense that there was a major incident at Gatwick. But I think this isn't new in the sense that the issues around drones have been known for some time, and obviously they're so freely available and have been allowed to fly so close to airports that I think that one of the main solutions is around the tighter regulation, which I think the government's already announced.
Well, that's a very nice segue into my next question, actually, which is about in what ways have you engaged with government and manufacturers to try and mitigate the issues?
I haven't had any personal contact with that. That wouldn't really come within my remit as such.
Well, it wouldn't become within your remit to have a conversation with the government about drone. I think it has been raised by the GLA. I couldn't commit to that. I haven't raised it personally. I think to say it was raised at the time quite vocally, and I think the government has indicated that they're going to take action on it. So in those circumstances, we'll monitor the sort of coming through of the legislation regulations, but it's not necessarily something. You don't see that's coming under your area of responsibility?
Probably not directly, no. It would. I mean, it's criminal activity and use of drones, and it is a threat to the security. It's something that's of interest to all of us, but I don't think that would necessarily specifically come under my
Sophie then.
My role. Yeah.
Okay. All right. Thank you.
Okay, thank you. Well, that brings us to a conclusion. Thank you very much, ladies. Very informative as always. Thank you to all other guests here. Thank you very much. Right, so can we note the report, including the performance report from the London Fire Brigade, and today's discussion?
Noted.
Thank you very much. Going on to the statement of assurance. We now move on to that for 1718. This report requests that the committee review the London Fire Commissioner's draft statement of assurance for 1718 and to make a report or recommendations to the Mayor on the statement of assurance in accordance with section 327G of the Policing and Crime Act. Are you all happy with that?
Yes.
Thank you. can we note the work programme and can we delegate authority to me as chairman in consultation with party group lead members to agree arrangements for any site visits, informal meetings or engagement activities for the committee's next formal meeting?
Agreed.
Okay. And, oh, just going back to the statement. Yes. Okay, we have to say, going back to the statement of assurance, just to make sure everything's done properly, we have to note the document, and once the committee has reviewed the draft statement of assurance in accordance with section, I said that, of the Policing Act, the committee must make a report of recommendations to the mayor, which is what we will do. Yeah?
Agreed.
Okay. The date of the next meeting is Thursday, 28th of March at 2 p.m. in the chamber. And as I've not been informed of any other business, the meeting is closed.
Thank you.
Thank you.